Good morning, students. Today we are going to discuss the scapula bone. So this is the scapula bone. So there are two scapulae in our body. What is important for any bone is first is the side determination. It is of which side. So the three important features which determine the side of this bone is one is glenoid cavity. This is the glenoid cavity you can see. So it is present laterally because it has to articulate with the humerus bone. Then second important point is the dorsal surface of this. It bear a spine. So this is a triangular spine which is visible here. You can see the triangular spine. So it is just present on the dorsal side. And this is the inferior angle which is facing inferiorly. So this bone is of which side? It is of right side. Next is what are the different surfaces and borders and processes of this bone? There are two surfaces. One is costal surface which is resting against the posterolateral wall of the chest. So this is the costal surface. And this is the dorsal surface. This dorsal surface is bearing the spine which divide the dorsal surface into two fossae, that is Supraspinatus Fossa and Infraspinatus Fossa. So these two fossae, they communicate with each other through a notch which is known as the spino-glenoid notch. So a communication is there. So this is Supraspinatus Fossa, this is Infraspinatus Fossa. Now coming to the three borders. This is the superior border, this is the medial border, and this is the lateral border. So these are three borders. What are the three angles? It has superior angle, the meeting point of the superior border and the medial border. This is the superior angle. So meeting point of medial and lateral border is known as the inferior angle, and this is the lateral angle where the glenoid cavity is present. Now coming to the processes. So it has three processes. One is spine. I told you spine on the dorsal side. This spine is triangular in shape, you can see. So this is triangular in shape. So it has anterior border which is attached to the dorsal side of the body of the scapula, and it has posterior margin which is known as the crest of the spine. So this is the crest of the spine. This crest has upper lip and lower lip. So it has two borders, anterior border which is attached to the dorsal side of the body of scapula. It has posterior border which is known as the crest of the spine, which has upper and lower lip. Then Necromion process. This is the Necromion process which is the extension of the lateral part of the spine. You can see this is the extension of the lateral part of the spine. It has medial border, it has lateral border, it has superior surface, it has inferior surface. The medial border of the Necromion process, it bears the oval facet. You can see this is the oval facet, and this oval facet is for the articulation of the lateral end of the clavicle. So to form the acromioclavicular joint. Now this is the Coracoid process which is attached just above the glenoid cavity. So this is the Coracoid process and it is attached to the body of the scapula just above the glenoid cavity. So these are the three important processes. Now coming to the glenoid cavity. This is the glenoid cavity. You can see this oval structure which is going to articulate with the head of the humerus. It has supraglenoid tubercle, it has infraglenoid tubercle. So these are the anatomical landmarks for this bone. That is, it has two surfaces, costal and dorsal surface, three borders, superior, medial and lateral border, three processes, that is Coracoid process, Necromion process and the spinous process. Now this superior border has a notch. You can see here the notch is present. This is known as the suprascapular notch. This suprascapular notch, if it is covered by a ligament, it is converted into foramen. So this is, if it is covered by suprascapular ligament, it is converted into foramen. Notch is converted into foramen. Now coming to the attachment. The costal surface of this scapula bone, body of the scapula, this is known as the subscapular fossa. It is giving origin to the subscapularis muscle. Now this is which border? This is the medial border. On the costal side, it is receiving the insertion of serratus anterior muscle. So serratus anterior muscle has 8 digitations. So first digitation is attached from this superior angle to this root of the spine. अगर हम इसका level यहाँ पे देखें, so this is the root of the spine level. So here is the first digitation, here is the second to third digitation is extending from the root to this medial border. And rest of the digitations, they are attached to the inferior angle. So first digitation is from superior angle up to the attachment of the spine level. So up to this. So this is first digitation. Next, second and third digitations are attached to the medial border, and rest of the digitations are attached to the inferior angle. So these are the attachment on the costal side of the scapula. Now coming to the dorsal side of the scapula. This dorsal side of the scapula, it has which border is this? This is the medial border. From the superior angle to the root of the spine, here the levator scapulae muscle is attached, origin. Then opposite to the root of spine, this triangular area is giving origin to the rhomboideus minor muscle, and below this triangular area to the inferior angle, here is the rhomboideus major muscle, origin is there. Clear? On this lateral side or lateral border, on the dorsal side, infraglenoid tubercle is giving origin to the long head of the triceps, and upper 2/3 portion of the lateral border on the dorsal side is giving origin to the teres minor muscle, and lower 1/3 is giving origin to the teres major muscle, and inferior angle is giving origin to the attachment to the latissimus dorsi muscle. So these are the muscles which are attached on the dorsal side. Now this spine is dividing the dorsal surface into supraspinatus fossa and infraspinatus fossa. To the supraspinatus fossa is the supraspinatus muscle is there. Infraspinatus fossa has attachment of this infraspinatus muscle. To the crest of the spine, this inferior border of the crest of the spine is giving origin to the deltoid muscle, and the origin of the deltoid is extending up to the Necromion process to its lateral border and superior surface. So this is the attachment of the deltoid. Clear? Origin. And the upper lip of the crest of the spine is receiving the insertion of trapezius, extending up to the trapezius, that is which border? Medial border of the acromion. So this crest is giving attachment on the upper side or upper border, upper lip of the crest is receiving the insertion of trapezius, and the lower lip is receiving the insertion of deltoid. Continue this thing on the acromion, that is superior surface of the acromion, and the lateral border of the acromion is giving origin to the deltoid, and medial border of the acromion is receiving the insertion of the trapezius muscle. So these are the muscles which are attached to this spine. Now coming to the coracoid process. To the coracoid process, 3 muscles and 3 ligaments are attached. What are the 3 muscles and 3 ligaments? That is short head of the biceps, coracobrachialis. These 2 muscles have origin from the coracoid process, and pectoralis minor muscle fibers are inserted on the coracoid process. And what are the 3 ligaments? Before that, you should appreciate the structures present in relation to the coracoid process. This is the glenoid cavity to which the head of the humerus is going to articulate. This is acromion process. This is coracoid process. And this medial margin of the acromion, I told you this is the oval facet which is going to give attachment to the clavicle bone to form the acromioclavicular joint. So lateral end of the clavicle is going to articulate with the acromion. So clavicle is present in relation to coracoid. So 3 ligaments are just connecting these structure. What are those? From coracoid to acromion, coracoacromial ligament. From coracoid to the clavicle, which is coming here, is the coracoclavicular ligament. From the coracoid to the head of the humerus, this portion. From the coracoid process to the humerus is the coracohumeral ligament. So 3 muscles and 3 ligaments are attached to the coracoid. Out of these 2 muscles are getting origin and 1 is getting insertion. Origin is of short head of the biceps, coracobrachialis. Insertion is of pectoralis minor muscle. Ligaments are coracoacromial, coracoclavicular and coracohumeral ligament. Now coming to the supraglenoid tubercle. I told you that this glenoid cavity has supraglenoid and infraglenoid tubercle. Supraglenoid tubercle is giving origin to the long head of the biceps. So long head का origin यहाँ से हुआ, short head का origin coracoid से हुआ, दोनों head join कर जाते हैं. So these are the two heads of bicep muscle. Clear? Now this is all about the attachment of the different muscles on the scapula. Now coming to the ossification. Scapula, it ossifies from 8 centers, 1 primary and 7 secondary centers. Now 1 primary is for the body of the scapula, and that primary center is also extending for the spine. Now secondary centers are those centers which they just appear after the birth. The primary center is appearing before the birth, and the age is 8th week of intrauterine life when the primary center it appears. Now the secondary centers are one for Coracoid process, which appear first, that is at the age of 1 year. So one center for Coracoid process it appears, and at puberty the different centers appear. What are those? One is for the root of the Coracoid process, which is going to form the part of the glenoid cavity. Clear? That center is given the name subcoracoid center. 2 centers they appear for the acromion. 1 center each for the lower part of this glenoid cavity, then medial border and inferior angle. So 1, 2, 3, 4 and 5, 6 and 7. So these are the 7 secondary centers which appear for scapula after birth. Out of this, at the age of 1 year, only 1 center appear, that is for coracoid process, and rest of the centers they appear at puberty. Rest of the 6 centers, what are those? Subcoracoid center, 2 for acromion and 1 each for the medial border, this inferior angle and lower part of the glenoid cavity. Now this subcoracoid center, which is secondary center, it fuses with the body by the age of 15 years. And rest of the centers, they fuse with the body by the age of 20 years. So this is important. So total, how many centers are there for scapula? 8 centers. Out of this, 1 is primary, which appear before birth and which is for the body. And that is also for the part of spine. And rest of the 7 centers are the secondary centers which appear. Out of this, 1 appear at the age of 1 year and rest of the centers they appear at pubertal age, at puberty. And subcoracoid center, it fuses with the body by the age of 15 year and rest of the 6 centers they fuses with the body by the age of 20 years. So this is all about the ossification. Now this medial border, if we see the applied aspect of this scapula bone, this medial border it become prominent, that is in some conditions. That is when long thoracic nerve is damaged, serratus anterior is affected. So medial border it become prominent. So this scapula, the inferior angle is just corresponding to the spine level of T7. So that is important again. So supraspinatus impingement sometimes happen, that is supraspinatus arc syndrome is there. So that's why the scapula is important. You should know the different bony landmarks, you should know the different ligaments and muscles which are just present around this shoulder joint. So that's why it is important bone. Thank you.